Okay, well, hello and welcome to this Skills for OT Students webinar on the topic of clinical handover. So this is the first free webinar that I'll be running in the lead up to launching my upcoming Your OT Tutor student membership to hopefully just give you a bit of a feel for how the sessions will run, what sort of topics I might cover so that you'll be able to tell whether that membership is the right choice for you. I'll tell you a little bit more about what we'll be covering in this session in a moment, but just first, before we go any further, I'd just like to perform an acknowledgement of country. So personally, I'd like to acknowledge the Quandamooka people, who are the traditional custodians of the lands, winds and waters where I'm situated to provide this session today. I pay my respects to elders past, present and emerging, and acknowledge all Aboriginal and Torres Strait Islander people present today or watching the recording. So I'm hoping that this session might go for about 30 minutes of content. So if you're joining in your lunch break or just watching the recording in your lunch break, hopefully you won't be able to, you'll be able to squeeze it all in and not miss too much. Happy to stay around at the end if anyone has any questions afterwards. And right at the end, I'll give you a bit of an update for what I'm planning for this student membership. And I'm very happy to hear any feedback or suggestions about what you think I should include. But in terms of what we'll be covering in this session, hopefully by the end, you'll be able to understand when clinical handover is required and why it's important, be able to reflect on what aspect of clinical handover is most difficult for you. And that's really important when it comes to practicing, which we'll talk about a little bit at the end as well, in terms of making sure that you're doing really targeted practice to make your practice as efficient as possible. You'll also be able to describe the components of the ISBAR format for clinical handover, practice delivering clinical handover utilising an ISBAR template. I'll also give you some suggestions that you can do. You don't need to do the practice in this session, but then when you do your practice afterwards, you'll hopefully be able to utilise some targeted strategies to really optimise that time you're spending practicing. For those of you that don't know me, though, I just want to give you a quick introduction to me in a nutshell in terms of what my experience is and why I'm running these sessions for students. So I graduated in 2008 with first class honours and a uni medal. So safe to say I've been an OT nerd for a long time. My experiences have been across public and private sectors in both inpatient and community caseloads, and I've primarily only worked with adults, but I have worked across neurosciences, burns, hand therapy, orthopedics, aged care, acute medicine, rehab, palliative care. Basically, think about all those caseloads you might come across in a hospital setting. Plus, I've also got a current sort of NDIS adult community-based caseload as well. So when I'm talking about all these different skills and topics in the session, I'll be drawing on all that different experience across a range of different settings and caseloads. And if there's anything that I don't have experience in, such as PEDS, I'll be using some of my network colleagues to come in and maybe help share their thoughts so that we cover as much as possible. My other background is that I work as a sessional academic for ACU. So I work with students all the time in that university setting. Plus, I've also had lots of students on placement with me when I was working more full-time as a clinician. So I really can see the difference between what you're learning at uni and what you need to know when you're on placement, and then also when you're working as a new grad as well. So I launched Your OT Tutor in July 2022. There's lots of different free resources, webinars, journal clubs, things like that on my website. You're welcome to ask me about at the end or just jump on the website and have a look. But one of the most recent things that I'm planning is a student membership, and I'll talk about what that involves a little bit at the end. Little plug at the moment as well is that I'm actually a finalist for the OT of the Year in the Allied Health Awards this year. So that's a bit of nice recognition for sort of how much content and resources I've been putting out there for the OT community, and a lot of them are for OT students. So if you haven't heard of me before, jump on the website and see if there's anything helpful for you. But enough about me, let's actually jump into the content. So we're going to start with the basics of clinical handover. So what is it? When do we actually do it? And why do we do it? So first of all, what is clinical handover? Now, if you do a bit of Googling, you'll probably come up with some very long-winded, jargony type official definitions, such as this one. So this one's from the WA Department of Health. And it says it's an explicit transfer of information supporting the transfer of clinical accountability and responsibility between healthcare professionals to enable continuity of care for the patient. So that may make lots of sense to you, but otherwise it could be quite confusing. So I've got my own sort of little bit more basic, simple definition just to get your head around it if this is new to you. So my definition is that basically it's telling another person, who's often a health professional, about your client and or their situation in a logical order with all the key information included so that they can receive the best care possible from the team. And when I say they, it's the patient. So lots of different sort of components that go into that, but the simplified version is that you're telling another person about your client and trying to get that really key important information across. It can be either verbal or it can be written. You might do it one-on-one with another health professional or in a group setting like a case conference or like a family meeting. It could be with someone that you know really well or someone that you've never met before and you're calling them over the phone to give this handover. And all those different factors will really determine what a clinical handover looks like in different scenarios. So I'll touch on those when we get to some examples at the end, or sort of not at the end, sort of midway through. But when might we actually do a clinical handover? So I've touched on that a little bit just then, but it could be in a one-to-one discussion with another health professional. So OTs could talk to a physio or a nurse or a doctor, either in a hospital or a community setting. Maybe you actually need to present your client and their issue or their situation at a case conference, which is when we often the whole team sitting around working out the discharge plans for a person, particularly in a hospital setting. You might need to present your client at a family meeting. So that's similar, but you have the whole team around and the family member and the patient are often there as well. And again, often they come up in a hospital setting when we're looking at trying to work out a complex discharge plan. They can also come up in community settings as well when we're trying to work through a particular issue and all be on the same page with the client. You could also use a clinical handover when you're presenting your client to a supervisor when you're about to ask for help or maybe preparing for a supervision session. And obviously, if you're talking to a supervisor who's another OT, then the language that you use and the content that you're going to include will be a little bit different compared to if you're doing a quick one-on-one handover to a nurse on a ward. And when we get to the examples, I'll talk through sort of what components might be a little bit different. If you're about to go on leave, happy holidays, but someone needs to look after your clients or your patients while you're gone. So we might actually do a written clinical handover in some sort of template or form so that if something happens to your clients while you're away, someone else on your team is able to easily see where you're up to and continue on the work with them. And it could also be providing like a briefing a team during an emergency. So something quite critical is going, the patient's getting quite unwell, maybe on a hospital ward, and you need to quickly share your information. So there can be really quite high intense situations as well. Hopefully as a student or a new grad, you don't get thrown into too many of those situations. But obviously the easier it is to do a good clinical handover, it'll be easier to handle those more stressful situations as well. So why is clinical handover important? So again, if you do some Googling, you'll come up with some very large technical jargony terms, but basically here's some of my key points. First of all, it ensures continuity of care. So basically that just means that there's no gaps in the person's patient journey. So everybody's on the same team. Once you're finished your part and you're relying on somebody else, they're taking over, ready to know, ready to keep going with that, and they're aware of what you've already done. So basically, it just allows lots of good communication so that things aren't missed. It can also be really important for patient or client safety. So in some situations, so like a hospital ward, ICU ward, it could be a matter of life and death. If things aren't handed over really clearly, then that could really compromise the person's care. But even in a community setting as an OT, it could really be the difference between someone getting really appropriate care or even just having a good quality of life. If we don't do a good clinical handover, we may not be fully informing the right members of the multidisciplinary team that need to be involved, and the patient ends up missing out. It's good for team collaboration. So obviously, if you're working in a team and it's very normal for everyone to be providing clinical handover day to day with keeping everyone in the loop with what's happening, then that's going to lead to a very good atmosphere of team collaboration because everybody's regularly talking to each other. Everyone's really on top of what the other person's roles are within that team as well. And finally, it can support accountability and responsibility. So you'll find when we get through the ISBAR examples, one of the last things at the end is a recommendation which talks about, okay, who does what now, basically. So obviously, if you're including that in your clinical handover and really clearly defining who's going to do what next, who's responsible for it, what time frame, then that's going to be really good for that accountability and responsibility so that, again, things aren't missed in the patient's journey. Okay, so hopefully now you've got a little bit of your head around what clinical handover actually is. Before we dive into some examples of maybe a strategy that could make it easier for you, first I want you to stop and think about, why is it actually tricky? So why is it tricky, particularly for OT students or new grads? And it's important to do this because you want to identify the issue, so that, like I was saying before, if you're practicing, if you just say, I'm just going to practice more, if you're not practicing the right thing, it's going to be a lot trickier. So if you don't take away anything else about clinical handover, here's a general point that I'd like you to take away from this session as a student, is that practice won't help unless you're actually practicing the thing that you're getting stuck on in the right way. So this is where the horror word of reflection comes in, that often students don't like to hear about. Doesn't need to be that you pull out the Gibbs cycle for every single patient interaction, but it's just thinking about, okay, if you feel that you get nervous or that you don't do a good job with your clinical handover, really stop and think about, why is it? Which part of the clinical handover really gets you stumped or that you're worried about, and really try to unpack that. And you can do that by yourself or with a supervisor as well. But what I'll give you on the next slide is a few suggestions that maybe might plant a seed. And just as I'm going through these, just have a think about, oh yeah, that's a difficulty for me. That's what I think is my main difficulty when it comes to clinical handover. Or maybe all these things are difficult. If you wanted to drop in the chat what the key concern is for you, you're welcome to do that. Otherwise, just keep it in mind as we go through them. So it could be that language and terminology is actually the tricky thing for you when it comes to clinical handover. So a lot of clinical handover that we do is verbal in nature. So we're talking to somebody about something, but sometimes we might write the handover as well, like that situation where we're about to go on leave or something like that. But for people where maybe English is a second language, so maybe you're an international student and you're finding even just basic conversation in English is a little bit challenging because you're trying to translate in your brain and think of the right word before you actually say that word. You're not just worrying about what you're saying, you're worried about how you're saying it and if you're saying the right word. So obviously that's going to make it a lot trickier for you as well. But it could even be if you find yourself in a very medical ward and there's so much jargon, acronyms, the rest of the team is using words that are actual real English words but make no sense to you because they're so jargon in nature. That can make it really hard for you to understand what they're saying back to you or asking, plus, trying to fit in, or should I be saying these words as well? And when do I say which one? What do they actually mean? So that's the challenge there. The eek, I don't know, I don't want to be wrong, is probably one for all the perfectionists in the room. So it may be that you're not too bad at your clinical handover, but you spend lots and lots of time preparing and practicing before you deliver one because you just want it to be perfect, whether it's to impress your supervisor or maybe that's just the standard that you set yourself. In this case, it might be that you actually do a really great delivery of your clinical handover. But if you're spending a couple of hours each day just practicing one handover that you're going to give in a case conference, that's not really sustainable as a student and definitely won't be sustainable as a new grad when you don't have that time for practice. And also it can be a lot of stress on you as well, where maybe it doesn't need to be perfect and still be good and appropriate to get your message across. So think about whether, that maybe is the issue for you. Another problem is that sometimes students are worried that they might miss something and they decide, oh, I won't say something because I'll get it wrong. I won't say the right thing. I'll miss something important. It's probably better to not say anything at all. I'll let somebody else say it, which isn't great, but this can often happen sometimes. Or the reason why you're scared of missing something is because you don't really have a good understanding of what the other members of the multidisciplinary team, what their role is. So instead of really doing a targeted delivery, okay, I'm talking to a nurse, the nurse needs to know this, you might actually give them everything. So it ends up being quite long-winded, includes lots of different details about the person, which may not necessarily be relevant to that person. And that can be a bit frustrating for the receiver if they're in a hurry. Another problem could be that you don't want to butt in. So if you've got quite a quiet personality or an introvert, then that can be a challenge for you. And believe it or not, for someone like me who's now on YouTube and social media all the time, I was a really quiet student. So I went to high school with literally 5 other kids in my year 12 class, did most of my subjects by myself. So I didn't really get used to talking in groups. But when I was a student, that's something I had to learn. And it is something you can practice with time. You don't need to be a naturally loud person to be able to do clinical handover effectively. But sometimes it can be tricky, knowing when you can interrupt someone to say what you need to say, maybe in a case conference or a family meeting. Or it could also be even based on your culture or your upbringing, where you've been told that it's rude to interrupt, or you don't want to be the center of attention. Or it could even be that you've had a previous placement where you did speak up and you got yelled at by your supervisor or another team member saying that you're out of place. And obviously that can be a really impact your confidence and knowing what you should or shouldn't be doing, and definitely something to reflect on and let your supervisor know why you might be holding back. And finally, the last point is, who doesn't love a good story? So if you're somebody that likes to talk lots, you might think that, there's so much interesting stuff about this person, surely everybody wants to know about it. So you might give lots of unnecessary details. So you tell them the patient's dog's name, you tell them what their last 5 jobs were. But what you end up with is a really long-winded story with lots of tangents, and you may actually end up missing the point of the discussion of what the really important issue you need to discuss in the first place. And obviously it could be really entertaining for the person, or it could be frustrating because they don't know what you're talking to them about and why you've decided to chat to them for so long. So have a think about which part might be difficult, and at the end we'll talk about some things that might make it that little bit easier for you. So let's get to the strategy. So what's going to help if you are having difficulty with clinical handover? So we're going to start with the structure, basically. And the structure we're going to talk about is ISBAR. So I'm going to go through what the components are, which is, you'll see in a minute, ISBAR is an acronym with a different bit of information in each section. And then I'll give you some examples as well. So first of all, what do I need to include in my handover? So the I stands for introduction. So this is basically where you introduce yourself, your role, and your client. Situation is where you're talking about what is the issue that you need to discuss, and not the long-winded explanation, just the one-sentence explanation of why do we need to have this conversation. B is for background, and this is where you give just the key points about the client's story. So not their dog's name, not their whole journey into the hospital, just the key information that the person needs to know so that they understand the situation you're talking about. A is for assessment. So that is, what have you done? What do you understand the issue to be? And then recommendation is, what would you like them to do next? And this is sort of that decision making, like I was talking about with the responsibility and accountability. You come up with a plan for whether you have a question for them that you need them to answer, or what your recommended strategy will be for the next part of the patient's journey going forward. And you can see there at the end, I've faded out request next to recommendation. And what you might find, if you do a bit of Googling, you'll see that there's slightly different variations of ISBAR. So you might find that those letters actually stand for something slightly different, or you might even find some versions where they've thrown in another letter. So I think ISBAR is another one as well, where they put in an O for observations. So don't stress too hard. Obviously, if you're on a placement and the where you're working has a particular framework that they use, then go with that, because that's going to be easier. That's it's going to be what people understand. But if there's no framework, this could just be a nice starting point as a nice basic one for you to get your head around. And just keep in mind that, like I was saying at the start, you might not include all of these, all the content in these sections in exactly the same way, depending on the context. So for example, in the introduction, if you're talking face-to-face with somebody who knows you well, you're not going to start with, "Hi, I'm Claire, I'm an OT student," because they probably know that already, but you will need to tell them which client you're going to be talking about. And same with situation. If you're sitting there in a family, like a family meeting or a case conference, and everybody knows they're there to discuss discharge plans, you may not then start with, "I want to talk about the patient's discharge plans." There's parts that you might be able to change, leave out, tweak a little bit depending on that situation. Now, what I do have on my website, there's lots of freebies, but one of the freebies is an actual template that takes you through those steps. And what I'm going to do next is I'll give you an example, but what I'll do, I'll just bear with me for a second. I'm going to drop in the chat some links. So if you haven't come across this on my website already, hopefully, either click the link and that will take you either a Word document or a PDF. So if you're someone that likes to type in, then obviously the Word document is going to be easier for you. If you just want something you can easily print out and scribble on, handwriting, then you might want to do the PDF version as well. So you can have a look at those, read through them as we go or check them out later. But right now, we're going to keep going for the demonstration. So I'm going to show you what ISBAR might actually look like in action. So I've got a couple of different examples for you, and there's an extra one as well on that handout you can have a look at, which is talking to a doctor. But the first one we're going to do is when you're giving a clinical handover to a nurse. So this is a short and sweet situation. It might be that you're calling from the OT department and you've just gotten through to the nurse looking after the patient on the ward. You might also do this face-to-face. So if you're doing it face-to-face, then obviously some of that content at the introduction you might change. But in this example, we'll go through it as if you were calling the person, so they're not opposite you as you're talking to them. I'll just run through the key components and then I'll run through what it actually sounds like. So in the introduction, you want to tailor it to suit the nurse. So if she knows you, you don't need to say exactly who you are, you're the OT student, all those sorts of things, what your role is, but you would need to identify the patient. The situation, so just keep in mind that nurses are very busy people. You want to tell them really quick and to the point why you're calling them in the first place and taking them away from their other duties. The background, remember, if they're the nurse looking after the patient, they should probably know the patient pretty well already, so you don't need to tell them the patient's whole story again, just enough for them to understand and sort of jog their memory of like, oh yeah, that's Mrs. Jones, I remember who you're talking about. The assessment part, this is where you're describing what you've done so far, and if there's any particular key issues that you want them to know about from what you've done with the patient, this is where you would put it in. And then the recommendation is this deciding, okay, what would you like her to do? Is there a question for her? Those sorts of things. So what does it actually sound like? It could be something like this. So introduction. Hi, Sue, it's Claire, the OT from Ward 5. I'm just calling to give you an update on Mrs. Jones, who's in beds 26. Situation. I've just finished her shower assessment, so I wanted to give you an update on how much help she needed and the plan for her shower tomorrow. Background, she's now day 4 post-total knee replacement and she's managing well. Assessment, she only required setup assistance and minimal assistance to wash and dry her legs and to help her transfers from the shower chair. I've just given her some long-handled aids so she can practice with them too. And then recommendation, tomorrow during her shower, could you please encourage her to attempt to wash herself independently with the aids and just help if she gets stuck, and then let me know how she goes. Thank you. So there you go. Nice, short, sweet, hopefully doesn't take away the nurse from her duties too much and just gives that really clear handover of what you've done and what the nurse can continue working on tomorrow. Obviously, if it's a little bit more involved in that, you can put a little bit more detail in. And it might also be that you add something written to their handover form as well. So it'll just depend on what context you're delivering that handover in. And then another example, so this time it's, where I said that you might actually give a handover when you're talking to your supervisor. So either you're preparing for a supervision session, they're saying, tell me all about your patient and what they're up to. Or maybe you need to call them because you're like, oh, I'm stuck on this thing. I need to just get some help with this one particular issue. So there's different scenarios, but obviously if you're talking to a supervisor, they're an OT as well. So you could be able to use a little bit more description of maybe the OT interventions or assessments you've done. And they probably want to see that as well so they can really understand your clinical reasoning to be able to guide you in the right direction when you get to asking them a question. So what might this look like? The I for introduction. Hi, Sally, it's Claire from the Ipswich office. I was just wondering if you had some time to discuss a client of mine, Mrs. W. Situation. I'm working with Mrs. W and she isn't agreeable to the recommendations I've made to increase her safety when she's showering. Background. Mrs. W has a diagnosis of MS. She lives alone and she currently stands up to shower in her shower recess, but she states she nearly falls or is too exhausted to shower. Assessment. I observed her shower transfers and she's very unsteady. I also noticed she became very fatigued and needed a seated rest after giving me a short tour of her house. So physical fatigue is definitely an issue for her. There currently isn't any AT in the bathroom, but when I made a few suggestions about some equipment that may make things easier, she was reluctant to make any changes. And the recommendation, I've discussed the risks of continuing to shower without AT and she understands, and I've also shown her pictures of lots of AT options, including the stools and chairs, but she still isn't agreeable to trial any assistive technology. Do you have any other suggestions for things I could try? So hopefully you can see there, you've presented your client to your supervisor in a nice logical order and you've explained what you've already done and what are those options you're already thinking about. So hopefully it'll be easier for them to guide you in the right direction. and hopefully not need to ask you to repeat too many or answer too many questions, because that key information should be there. So have a look through those, watch that a few times if you need a bit of preparation, need a bit more practice for it to absorb in. Write yourself some notes on the template as well. So this is bringing back sort of scenarios to your mind of how you might have been able to hand over a client, then this might be some examples that you can draw on. Okay, the final section is just over to you where you can do some practice. Like I say, we're not going to do it in this session, but hopefully these will be some tips that you can take away and practice later on. And just sort of as a bit of a heads up in terms of how I'm planning the membership is that we would do some of these deep dive sessions, but then also alternate that with other sessions where you can come in and actually just practice these things in a Zoom room with me giving you feedback. So there will be opportunities to do both those things. So if we just jump back to some of those difficulties that I said at the start of the reasons why people might have difficulty with clinical handover, particularly as a student or a new grad. So remember, one of the issues was maybe just the language or the terminology. So either English is your second language or there's just so much medical jargon that you're having trouble keeping up with. So a strategy might be that for you, it's actually really helpful to start by writing a script. So actually a word for word script where you can double check all those words that you're a bit stuck on and that you keep thinking about when it comes to verbally saying it. If you're calling somebody over the phone, it could even be that you can refer to that script as for even dot points when you're talking to them. Obviously, if you're face-to-face with someone, you're not going to want to go up and hold a piece of paper and read it. But that can be a really important first step, just to make sure that you're clear on what sort of words you're going to be able to say. And if you're unsure about any, where you can check with your supervisor as well. If there's lots of jargon, it could even be just keeping a list of abbreviations with you. Whenever you come across one, write it down in a notebook. And when you've got 2 minutes on the ward because your supervisor's stuck somewhere, go through that list, test yourself so that it becomes really more common to you. And that's going to help with other things like documentation as well. If you're the perfectionist and you're spending too long actually preparing and thinking about it because you want to get it perfect, it could actually be that maybe you set yourself a bit of a time limit for your preparation. So it's like, yep, I've got to talk at the case conference about Mrs. Smith. I'm just going to spend 20 minutes jotting down some notes using that ISBAR format about what I want to cover. And even though it may not look anything perfect in your mind, take that to your supervisor at sort of at that draft level and run through, this is what I'm thinking about saying. And your supervisor could surprise you and actually say, how you presented that was pretty much perfect for what we need it to be. You could just add in this one little thing. So instead of you wasting time second guessing yourself, trialing different things, thinking it's not good enough when actually it could be, set yourself a limit and get in touch with your supervisor sort of at that draft early version. If you're someone that's worried that you're going to miss something, so you tell them everything because you're not really sure what information they really need for their role, and sometimes it's just making time to understand their role in more detail. And again, could be helpful for planning your assessments and treatments as well, not just for clinical handover. But it could be something like you just book in a chat with the speechy on the ward and find out, can I sit down with you and just find out what you normally do with the patients, what sort of information OTs would normally tell you, so that I can keep that in mind when I'm talking to you. Could also be that you were observing what sort of questions they ask in a case conference. So what sort of information are they asking other team members for, or what information are they contributing to the discussion? So then you can think about, oh, if I found out something about the client that's relevant to that sort of information, that might be something that you need to include in your handover to a speech pathologist or in a team meeting. And it could also be doing a joint session. So just jump in and either observe or do a session with them, with the client, and see what sort of information are you sharing? What are your common goals? And that's going to help you determine what is that important information to get across to the speech pathologist. If you're that quiet person that doesn't really want to butt in, or you're sort of worried that you're going to get in trouble if you speak up when you shouldn't have, then it's really important to get your supervisor involved in this. And hopefully they might be able to do a bit of scaffolding for you, hopefully reassure you and talk to you about when it is appropriate to speak up or versus not speaking up. Sometimes it's different team dynamics where there's particular medical staff or other allied health staff that, you know, it is better to sit back and wait for your supervisor to do that introduction in the early days. So just have a chat to your supervisor about what your experience has been and if that is holding you back. And what they might be able to do is they might be able to do a bit of scaffolding. So it could be that maybe they introduce a client in the case conference and they're talking about, yeah, we've been doing this with Mrs. Smith, but then they give you a nice opening so you know very clearly when you can start delivering your clinical handover. So they might say, oh, but Claire's been working on Mrs. Smith with that assessment or with that treatment, so I'll let her talk about that now. And then obviously you don't want her to be relying on your supervisor to be able to give you that introduction every time, but it can be a really good starting point just to build your confidence that your clinical handover is received well and that you're doing a good job with that. And then you can build more confidence about when you might want to jump in, and you can be observing your supervisor. So when they're jumping into conversations, what sort of opening were they looking for, and really discuss that with them. What made you feel like it was safe to say something then? Those sorts of strategies can be really good to actually talk about explicitly in your supervision. And then finally, you're the storyteller that likes to talk too much. And really helpful strategy can be role playing. But if you're role playing with your supervisor or a student, not necessarily the client, actually just record it. And then you can watch yourself back and critique yourself. So, how good was your story? Was it an awesome story, but maybe the key point of that clinical handover was missing? What sort of information from the ISBAR format have you actually ticked off and you did include? Did you actually start at the recommendations and miss all the introduction? That's what confused the person at the start. So do yourself a bit of a critique, but I know that when students do sort of reflect and they think about what they did well or not well, they focus on the not well. So chances are there's something in there that you did do well. So make sure you make some time thinking about what you did do well so you can build on that as well, not just address the things that were maybe not so perfect. And just as a little extra way of thinking about these things is that was all very clinical in nature. And even though we're talking about ISBAR in terms of clinical handover, the actual format of ISBAR can be used in non-clinical situations. And again, if you're just trying to get your head around, the order of things, it could even be helpful to do a non-clinical practice. You're sitting in sitting somewhere in a certain scenario where you need to talk to someone about an issue. You're like, can I put this into an ISBAR format? So obviously not going to be how it works for everybody, but it could be another strategy that you can try. So as an example of what that might look like, this is somebody that's ordered their lunch and it hasn't turned up and they need to go talk to the restaurant staff. So you could say something like, hi, my name's Claire. I'm sitting at table 8, the introduction situation. I ordered my meal about 40 minutes ago, but I still haven't received it yet. In the background, it was just the soup of the day, which I ordered because I'm a bit short on time, and the waitress said it would probably be out within 10 to 15 minutes. Assessment, I really can't wait anymore, so I just was wondering if you could chase up what happened with it. And the recommendation, if it's not ready now, I probably would prefer a refund so that I can be on my way. So you can see that sort of format can help just to practice in non-clinical situations as well. Got some more video resources for you as well. So they will be sent out. I will send out a copy of the slides or a link to where you can download the slides if you're accessing the recording, and you'll be able to click on all of these links as well. They're just some more video examples. One's a summary that I did on my YouTube channel, and the others are some health related examples that have been put up involving medical situations as well. Now, if anyone does have any questions, you're welcome to drop them in the chat or unmute and ask me, and I'll cover those. But just for those that do need to run, I'll quickly run through what's coming up in the Your OT Tutor student membership. And those that are a bit nervous about asking questions on the recording, I'll stop the recording and then you can ask me as well. So just quickly, what's coming? What am I planning with this Your OT student membership? So basically, I've got an OT membership called the Yacht Alliance or the Your OT Tutor Alliance that you're welcome to check out, even as a student or a new grad. But what I'm looking at developing is something really specific to students and the type of issues that I've got lots of students reach out with difficulties either understanding concepts at uni or learning particular skills on placements. So I wanted to basically try and address those and give you some other tips that might be able to help. So I say it could be skills like this, like clinical handover that you will need for your placement, or documentation tips, or how to do a particular assessment. It could also be things like concepts that you're learning at uni. So I work one-on-one with lots of different students, and I've worked in a couple of different universities myself, and there's always common things that trick students up. So it could be, how do you actually apply one of those OT theory models, or how do you do reflection in practice? I never see my supervisors doing them. What does it actually look like? And it could be even things like, how do you do evidence-based practice when you're a busy OT and it doesn't seem to be time to do a whole literature review like you do when you're a student? So we're going to put all these topics into like a weekly live session. So hopefully for about half an hour a week, if that's all you can put into it, you'll be able to take away some key points that will really help to build together to make it easier to be an OT student and then eventually an OT new grad. Everything that I present in these weekly live sessions. So like I said, it could be a deep dive type webinar where I'm presenting information to you like this. It could be a drop-in practice session where we actually just do lots of role plays and practice and I give you feedback. It could be, like I was saying, I'm not an expert on all OT topics, so I might get in a guest presenter to actually just tell you a little bit about what a day in their life looks like in different caseloads, and you can ask them different questions, in particular about what it might be like as a student in that sort of caseload. And also just some general Q&A sessions with players. So come and ask me anything about anything in relation to anything that I'm likely to be able to answer, hopefully OT related. So we'll do those live sessions. They'll be recorded. Obviously, if there's parts that can't be recorded due to privacy reasons or concerns or whatever, they'll be edited out. But as much as possible, will be recorded and put into an on-demand resource library. So you can sign up just for a week and binge watch as much as you can for that week. Or you might find that it's a helpful resource to just be able to jump in and out of whenever you like. And you'll get access basically like a video library. So it won't be Zoom links that expire or anything like that. You can watch them whenever you need to, as many times as you need to. Also looking at putting together some networking or study buddy type situations. So it might be that you're an OT student that really wants to practice, but you don't really know of any other students who would want to do that practice as well. You'll be able to share your details as much as you want or don't want. It's not compulsory, to maybe make connections with other students that want to do some practice with you. This will hopefully be as low cost as possible. So might even be, definitely less than $10 a week, maybe even getting it down to $5. I'm still crunching my numbers. And I'm also looking at getting some sponsors involved as well. So there might be some scholarship opportunities if you've really got a lot of financial hardship, but would be really keen in getting some of this content and support. In terms of when it's launching soon, it really depends on when people want it. So my original plan was to make the announcement, spend lots of time giving you some free sessions, some trials and putting it all together, and not really launching until January or February next year in 2025. But I've had lots of students come to me and say, I'd like to do some practice over the uni break before my big placement starting early next year. So if that's you, if you want this ASAP, then please just shoot me a message and let me know. And obviously, if there's lots of people that want to sign up early, I'll do my best to get it out there as soon as possible. But if everyone's already in holiday mode thinking about that, then we'll just start fresh in 2025. But one thing that I'd love your help with is I just keep calling this the Your OT Tutor Student Membership, which obviously explains very clearly what I'm talking about, but it's not necessarily catchy. So if you've got a great idea, ChatGPT hasn't really been kind to me and inspiring me with great suggestions. But if you've got a suggestion for what we could call this, so my normal membership is the Your OT Tutor Alliance, but if you've got something else in mind that might be appealing to students, very happy to have your suggestions, so throw them at me. Now, for those that do need to go or those watching the recording, if you do have a question about clinical handover or about the upcoming Your OT Tutor student membership, then you're welcome to get in touch. You can either send me an email directly on my website if you haven't been there. Give yourself some time and go through particularly the learning library and the journal club session. You can access a whole lot of things for free there. And then there's also a link there, which I'll send when I send out the recording, that's got just to my main link tree. That's got all my best stuff, all my social media links as well. If you want regular free content and tips, best thing to do is jump on LinkedIn and follow me there, because I share a daily post with lots of resources and tips, not just my stuff, but things that I've come across from other OTs as well. So for those that are still with me, who had the question, I know you haven't dropped it in the chat, that's fine. So what I'm going to do is I'll stop the recording. For those watching the recording, thanks very much for sticking with it this far. Like I say, if you do have any questions, please just get in touch, and hopefully I'll see you at one of the live sessions next time.